Hello guys, good afternoon. Welcome back to my YouTube channel. This is Miss Henderson. Guys, today I am providing you with a few slides on the final exam. So I just wanted to create a few slides to go through a few questions on the exam that's going to be coming up pretty soon. So again, if you like content like these, please consider subscribing to our YouTube channel. Please like and share, and please drop your comment in the comment section of the video. So we have the first question here, and this question states that when cleaning a catheter, you should clean from the insertion side downwards with a circular motion with an upward motion towards the insertion site. So when we were doing the skill about catheter care, I showed the student how to hold the insertion site and clean downwards, 4 inches downwards, the insertion site. The reason and the rationale for holding the insertion site is to prevent the catheter from coming out, basically, and cleaning the catheter downwards, 4 inches downwards. That is required how to take care of a patient catheter. Must clean it downwards, 4 inches downwards with warm water and soap. Let's look at another question. So question 1 will be clean from the insertion side downwards. A is the answer. Question 2 we have here. This is not a difficult question, but students still get this question wrong. So it said catheters are used for what? What do you use catheter for? Do you use catheter to promote comfort for your client, to keep the bed dry, to collect a urine specimen, or for incontinent clients? So think about the reason why would you use a catheter. So a catheter is a tube that is inserted into the patient. The doctors or the nurses do insert the catheter, and it is used for certain reasons. So why you think a catheter is used? So the correct answer for the catheter use is to promote the patient comfort. A is the correct answer for this question. Question 3 states, bed rest places a client at risk for what complication? A, plantar extension, B, internal rotation, C, orthostatic hypertension, and D, blood clots. So what do you think bed rest will place a client at risk for? Obviously, it's not orthostatic hypertension. In any case, it would be orthostatic hypotension. So C is out. Also, A is out, plantar extension and internal rotation. So those are out. So what do you think? So a patient is placed on bed rest, and when you're placed on bed rest, it increases your risk for like thrombosis, for blood clots. Blood clots can develop due to lack of immobility and you lay in one place. And if the blood clot travels to your lung, you can really have a pulmonary embolism, which is dangerous. So that is why they when the doctors are doing surgery on patients, it's recommended within the first 24 hours, 48 hours, you can get up and at least move around a little bit so you can get your circulation going. So the answer for this question number 3 will be blood clots. Let's look at another question. Cystitis is treated with a lot of students get this question wrong as well. Cystitis is inflammation of the bladder. And how do you treat inflammation of the bladder? It's a bladder infection, actually. High sodium diet, dialysis, fluids and antibiotics, drugs and fluids. So how would you treat a bladder infection? The only one that makes any type of sense, dialysis is for renal patients. We all know that. High sodium diet, that's out. The only one that makes any type of sense will be fluids and antibiotics. So anytime somebody have an infection, it's always recommended by the doctor to increase the fluid intake, and also antibiotic is prescribed. So it will be fluid and antibiotics. That's the correct answer. So guys, these questions are not that difficult, and a lot of students get them wrong. They may appear to be very simple questions, but I've seen it that student time after time they choose the wrong answer. So it's important that you read the book and try to understand it. Okay, question number 5. The pancreas secretes what hormones? A, progesterone, B, estrogen, C, testosterone, D, insulin. So progesterone and estrogen, we know those hormones are secreted by the ovaries. We know that for the female. And we know that testosterone is secreted for the male. So definitely wouldn't be progesterone, it wouldn't be estrogen. The only one that makes sense is insulin. Insulin is secreted by the pancreas in order to metabolize your carbohydrates, your glucose. So that's what breaks down the glucose molecule and kind of helps to level out your sugar, is the insulin. So it's these the correct answer. Guys, again, if you like these types of videos and these types of content, please consider subscribing to my YouTube channel. Please like and share and drop a comment on this video. I'm creating the videos for the CNAs to help them pass their Prometric exam. Thanks for watching. Bye for now.